In the Netherlands, we have a high-quality healthcare system. For every disease, there's a doctor. And if you have a lot of diseases, that logically means that many doctors are involved. Do you realize that 1/3 of our population has more than one disease? We call that multimorbidity. And often, physical and cognitive problems come on top of that. Current care is insufficiently equipped for this growing group of patients. I contribute to integrated care both as a doctor as through research, innovation and training. Treatment beyond diseases that is well aligned to the patient and optimally coordinated is the future. I would like to declare June the 16th as the day of multimorbidity. One day a year to give attention to those patients that are treated everywhere and therefore maybe basically nowhere. I'm Barbara from Munster and I'm a geriatrician. Let's start pushing the boundaries.